like to talk about health care, and we'll start with you, General Poythress. The Department of Community Health says that the federally mandated health care system will cost Georgia about $100 million a year because Medicaid enrollment will skyrocket. How will the state pay for that? Are you in favor of this health care plan? And if not, what would you like to see happen with health care?
Well, I don't think anybody knows what the federal health care plan is. There was a model out there that by most accounts would have cost the state $100 million. The state doesn't have $100 million. I mean, that's perfectly clear. I think every state in the country made that clear to the president, and therein is where that law is being revamped. It seems to me that there are really two issues here. One is how you pay for medical care. That is essentially a national issue, and we're seeing that debate raging all over the country, obviously very intense feelings about it, but that isn't, given the mobility and the size and the character of our society, that is essentially a national issue, and it will be resolved at the national level. As governor, there is one thing that I can control, and that is access to care. Access, particularly below Macon and below the fall line. There are large parts of our state where we do not have adequate care. I will support and indeed expand those incentives that are already in the existing law to attract and keep doctors, and also to build out our trauma system statewide. It's about $80 million. We can find that money and build that system out.
Mr. Baker.